called by the gynecologists, the team of gynecologists and other doctors who were doing a complex operation on this patient who had a big abdominal tumor, which they thought was from the origin, from the ovary. Sorry, they thought it was coming from the ovary or some of the gynecological organs. So the tumor was quite huge and was touching a lot of other tissues and other structures. So typically we help each other because not one doctor does everything. So if it's something that's encroaching into another patient's territory, you ask for help from them. So that's how I got involved. I came in almost towards the end of the work when they'd done most of the work in terms of
surgeons for Mpilo.
Everyone is concentrating.
Tubes and so on the intestines. So that's how I got involved. And also just to help with stopping bleeding, because there was some bleeding that was going on. So that's basically where I came in. Then we assisted and they managed to fix whatever was not okay, stop the bleeding. Then the patient was taken out and taken back to the high care wards that where she was sent. Yeah, for general surgery, yeah, it's something that is, I would not say common, but something that we do meet occasionally. So every once in a while we do meet such cases. It's not common, so that's why you find when you do get one like that, you have to have a big team, because you have to tap into experiences of other people who might also have seen a bit of that. You have also seen a bit of that. You combine all your experiences and you are able to help the patient. But it's not common. It's not common. Basically, doctors who are trained, who are well trained, are very good. Of course, sometimes we do lack a bit of equipment here and there, just like everywhere else. But the qualified people are actually there. It's just that our people need to have confidence in the system that is there. That the doctors are capable of doing the work. Sometimes we get people, they go to South Africa, they go to India for things that we can do here. And the money that they pay, that they pay to get that work done, they would have paid just a small fraction of that, and have the service done here, family and friends all around them. They could have gotten that service. So I think people should just trust the services that are available. Of course, yes, there's room for improvement in terms of equipment, in terms of medication, in terms of even our infrastructure in general. But overall, I think the manpower and the people that are required to do the work are actually there. And with enough patience, these things will get better.
Can you explain?
So basically, this is a relatively young woman, 32 years of age. Do you know where she's from?
Mberengwa.
Yes, from Mberengwa. Has been visiting the hospitals for some years. Initially seen at United Bulawayo hospitals, where she could afford the CT scan, which she had requested. So basically, we started seeing her about 3 months ago with a very big abdomen, having some difficulties in walking and feeding. So then this is scheduled for the operation this week, after we've done some scans. So she was basically operated on the 10th of November. It was a very big mass, so we managed to remove it, going up almost 50 kgs, that particular mass. The operation actually went relatively well, and she's still recovering quite well in 90 minutes. she needs what we call HDU. Why she's there? Because basically that mass was so big. It was actually also pushing the bowels and the lungs. It was actually displacing. It was many organs actually. But as of now, she's doing very well. Thank you. Alright. The initial scans which have been done pointed towards probability of a tumor which has arisen from one of the ovaries. So when we opened it, it was very difficult to discern where actually it was coming from, but most likely it was coming from the left ovary, and it was stuck to so many structures like the uterus, the bowels, and actually encroaching into the diaphragm. So most likely it's an ovarian cancer, but in the lab will confirm for us what type of tumor it is it cancerous or not, and what type of cancer, if it's cancer.
Was this the first time?
During my time here, I've never seen such a big mass. We've operated these big masses, but not as big as this, and not as heavy as this one. Because already the pressure has been removed from those organs, so we expect that we are almost 100% certain that she will recover very well. So because of the nature of the mass and what the patient was feeling and where it was pressing on other organs, so we actually got assistance from many colleagues from our department. There were 2 consultants and also 2 registrars. From the anesthetic with a senior consultant,